generally we've not been testing for HMPV because it's not been a major thing. But now, we've heard about this now. We're trying to see how we can increase the laboratory capabilities to be able to test for that. Luckily, the only thing they need is some reagents that we require, which we're going to start stocking now and start sending out to those people. They have a staff who can do this in those various laboratories, but again, part of that program is to train the staff, just to retrain them to be able to show off those systems. And again, it presents just like many of these respiratory problems, cough, fever, sneezing, all those funny things. And there's no known drug for it, and there's no vaccine for it. So it has to be treated symptomatically, just like you treat flu or the common cold. But again, the idea is that unless the health workers have increased level of awareness, so people who they see, there is one of the things they have to have in their minds and start testing for all those things. So those are the things we're doing. Laboratory capabilities here, we have NRL, we have a CPHL in Lagos, and then we are looking at the states where these airports are, and see how we can optimize their capabilities. And of course, we'll extend it again to the regional labs where they have the wherewithal. So one of the other things again is that alerting the state governments, also they have to be on the lookout, establish their own preparedness and response capabilities. Those of them that have treatment centers or association centers, just get them ready just in case you may need this. We are not going to quarantine anybody right now. But if there's going to be a need, we have to do that. You don't wait until you need it before you start looking for. So the idea is preparedness. But again, like I said, we need to care. I remember this morning I got a call from a Chinese embassy, and I think they misunderstood what was sent out yesterday. We'll try to douse that tension. But once they finish their own gap analysis, especially with respect to the social reports, they will let us know when they're going to start. And again, they need to work hand in hand with FAN, because they need to work hand in hand, or else they're going to disrupt the activities at the airports. And those it has to be well properly coordinated and all. And again, the diagnostic capabilities now, the states near there again, see where they can refer samples to just in case they have all this.
And there we have the update there on the human metapneumovirus. That, among other things, will form our conversation this morning, especially when it comes to the health sector in Nigeria for 2025. And joining us is the man you just saw on that screen, the Director General of the Nigeria Center for Disease Control, Mr. Jide Idris. Thank you so much for being with us on the program.
My pleasure, and good morning.
I mean, I was thinking, when this HMPV story came out, I was like, oh my goodness. Oh dear, it would not be good to be. I mean, the last DG that had to handle an outbreak like that when COVID happened, I was like, oh dear, that would be so much work again. But just so we can understand what this is, and what the checks are, and the readiness of the country for it. And many people out there still have issues with the COVID situation and how it was handled in Nigeria. Many people thought it was really high-handed in its handling. Some people actually think that it didn't even exist, or this was just some money-making venture and things like that. But just so we can understand what this threat is and where we are on the scale.
Let me say, well, there's no serious threat for now.
Okay.
That's one. Two, this is a HMPV virus. It's not a new virus. It's just that it's not well known, but it's been implicated in many respiratory infections over the years, over the countries, especially in children, elderly people, just like the normal flu, cold virus, or influenza, respiratory syncytial virus. It's just one of those causes of respiratory problems. Unfortunately, again, some of these viruses, organisms, again, undergo mutation over the years. They change structure. In changing structure, they can become more effective, and they can present
and more resistant to treatment.
And that's why again now that they are categorized, got virus under monitoring, virus of interest, virus of concern. That's great. We are in the monitoring phase now, alert phase, and that's why again we take instruction from WHO globally because every country is supposed to report cases like this, any case, any problem, to WHO. That those is that they consider might become global problems later, so that they can alert every other country to get prepared. That's precisely what we are doing in Nigeria. And luckily, we've been, I don't know, we've been fortunate enough to have, we've experienced some major problems. You had Ebola, you had COVID. With those two, we developed some capabilities, we learned our lessons and putting up infrastructures in place. These are public health infrastructures. These are things you need to put down in place in expectation of things like this, so that you don't have to start running health as it cuts across many things. You need to have your leadership structure, governance structure, who takes charge of what, who is responsible for what, whether at national level, state level, or local government level. You need to build infrastructure. Now, in the health sector, it's hospitals, but in this kind of situation now, it's public health infrastructures, laboratories, isolation centers, treatment centers, make vaccines, whatever it is. Look at your human resource needs. What are you likely to need in terms of resources? Human resource, for instance, it's not the typical medical doctor, nurse, public health trained people who can respond, epidemiologists.
I mean, I want to talk a bit about public health because we have a minister who's a professor of public health, and he was in charge of the primary health care.
Yes, NPHCDA sometime back.
I must forget that he used to be Minister of State under Minister of State for Health under former President Goodluck Jonathan.
Definitely.
So he's he was also director of the Global Financing Facility for Women and Children and Adolescents. He's done so much. And former CEO of Gavi, the vaccine alliance. So we have a health minister that is very public health oriented.
Yep,
in the way he handles his every situation in this country. Now, let's just get some things out of the way. Nobody has HMPV in Nigeria for now.
Nobody has HMPV in Nigeria, but let me correct this. We have not used to testing for HMPV because it's something new.
Is the testing available right now?
The testing now, we have included it in our normal testing, sentinel services to look for it, because of this alert. So it's now been part of our protocol. Now, because it's not been used to testing that before, now there's certain things we need to put in place, especially when it comes to testing and making diagnosis. It requires certain reagents, let's put it that way, or consumables to use to test. So those ones we need to put them in place again, procure them, distribute them to different laboratories.
So we're getting ready for capacity
to test. That's part of preparedness.
As a disease, is HMPV worse than COVID?
Well, they all produce similar symptoms.
Yes.
Respiratory symptoms, cough, sneezing, and they affect similar people. The problem is that once they are caught for HMPV, it's a normal thing, but very few people, most people don't even, reflect the symptoms. But in some key people, they can get worse, can go into pneumonia, especially in children, people who are immunocompromised. So those ones now, you get ready. Unfortunately, they took a while for COVID to develop vaccines. There's no vaccine for HMPV.
That was what you meant.
There's no drug. There's no drug for
it.
HMPV. However, just like typical normal cold, flu, you have antiviral, which are not very common here, but again, you treat them symptomatically. So that's why again, you need to be on the alert. The medical professionals, the healthcare workers again, have had heightened tension, so that they be on the lookout for things like this. They can appropriately to hydrate, reduce fever or temperature, clear your nostrils, and avoid areas where there's serious overcrowding, where there's no airflow is limited, and develop this respiratory etiquette. When you are coughing, you are sneezing, do it properly that you don't spread these things, and wash your hands. Hand washing is very critical, because if you don't wash your hands, the chances that you're going to use it as a point of spread.
Because I've seen all the conversations around it, presents flu-like symptoms. If it's presenting flu-like symptoms, and medication for the flu can get rid of this, why are there alerts about it?
The alerts
because it's flu season. It's normal for people to have flu around.
But again, there's tendency again that it can get out of hand. Like I told you, some of these viruses can undergo mutation. Okay. They can become more virulent, and that's why, again, people test. Research workers are ongoing studying these viruses because they're under monitoring. And again, the people who have to deal with them, again, must be prepared just in case. So, like COVID is a variant of the flu virus. It became more virulent. I have different variants now. If you remember, the last one was, I forget his name. Mm-hmm. You have, about a month ago, we were talking about the XZ variant. It's another variant of that COVID-like symptoms. There are very many. And again, so that's why, again, we need to be on the alert. We track. Luckily, again, some of them can be addressed the same similar way. So if you set up your public infrastructure to be able to address the same, reduce the tension, educate the public on what to do, what not to do.
You talked about sentinel systems, and I'm guessing that has to do with entry points into this country.
No. Sentinel systems are a national influenza sentinel system.
Okay.
We have sentinel systems for different diseases. Yeah. One, you carry out research on diseases. You detect diseases, you look at them, you track them, you test them. And some do research on them. Some in testing, when they fall sick, you refer them to the various laboratories for treatment. So we have sentinel sites in different healthcare facilities like teaching hospitals, laboratories, that actually monitor these diseases.
Oh, okay.
And we have centers for different diseases, just like you have for mpox, you have for... Now, for parts of health, it's entry points. These are part of the public health infrastructure, especially diseases now that have a tendency to be brought in due to global travels. And that, again, is another area of concern. Because now, so these viruses are we found in China, Japan, and all these places now. They have the tendency to be brought into this country, and that's why the port health services need to be on the alert. They're on the alert. They themselves are going through their normal preparedness protocols. They're developing protocols for this. And of course, they have to work hand in hand with different people, especially at the airports now. They have to work hand in hand with NCAA, work out the modalities for cooperation, how you get patients again. So it's just you are doing the preparedness phase.
When COVID happened, one of the things that we noticed, and it wasn't just in Nigeria, it was everywhere around the world. Anywhere you went to at the airport, they would check your temperature.
Definitely.
If your temperature was a particular figure, they'd
put you aside.
Is that going to be happening? Is that part of the preparedness for HMPV?
It's part of the preparedness, but we don't hope to get to that.
Okay.
But it's always good to have that protocol ready, that when the thing becomes increased or something like WHO alerts, well, look, it's now a virus of concern. We set up all those protocols. But now you already have it ready. You have the procedures. You have a standard operating procedures ready. You have the people you need positioned in different places. Then seamlessly it becomes easy to manage those cases.
When these sorts of outbreaks happen around the world, entry points into Nigeria, usually the airports,
right now,
our porous borders, and the hospitals. Are there things set in place there to watch out for this sort of thing?
So typically for our preparedness response, we have different pillars. We address different issues. Points of entry, one, for the airports. What we've done again now, the 4 major international airports are being on the alert. We're linking them up with the different state governments in that place so that I can link them up to the laboratories in those states and optimize those laboratories in case of things like this. And mind you again, as we're talking about, we are managing almost about 8 outbreaks in this country, not only HPMV. Luckily, again, the systems are similar, just modify them based on the organisms we are dealing with. That's very well. So you look at the human resources you need, maybe at the airport, maybe in the laboratories, and you train them, you get them ready, and right now most of them are in the states. So we're in contact with the state governments again. Let them set up their own preparedness systems, get the treatment centers ready, get the isolation centers ready, get their staff working, hospital facilities ready, just in case this is, and let them be unaware. We send out case definitions, was this kind of thing, this is what to do, X, Y, Z. Those are protocols so that they will not be caught unawares. And this is cuts across, again, the public awareness is key. Just like we are sending out advisory now to different things, how this virus is, what it entails, how it manifests, how it is spread. We do the same thing for virtually every single disease of public health interest in Nigeria here.
What happened with the Chinese government? You said they may have misunderstood what the advisory was.
No, I think there was an advisory let out.
Yes.
Not from NCDC.
Oh.
That says that people are going to start send them to quarantine to anybody that comes in. And they felt they were specifically targeting Chinese.
Anyone? So what? You're saying that circular didn't come from the NCDC?
Not from NCDC.
Do you know where it came from?
I think it was a release from the Ports Health Services there.
Okay, so Ports Health Services.
Yeah, so we needed to douse that tension.
So the Chinese government thought because the HMPV came from their country,
in this kind of thing again,
catching Chinese people.
In this kind of thing, you have to play the politics.
Yes.
Global politics. Mm-hmm. Before you say anything, you must have the facts. WHO has not declared the public health of international emergency, so there is no need for us to start doing that because it can affect trade services, it can affect all sorts of things. It can affect public relations. So
you had to break that down.
Yeah, you have to break down that. Yeah, you need to be sure that what you are dealing with is the right situation. But if there's anything for us to start that, we'll start that. Irrespective of what people think. You understand me? But again, there's no need for now because there's no cause for alarm for now.
Well, there is cause for alarm. Is our public health structure?
I agree with you. That's the alarm is that we are getting prepared.
Okay. Let's talk about other diseases that we're dealing with. There's a rise in Lassa fever. Cholera. Lassa
fever season.
Yes, and cholera.
Cholera. Well, luckily, cholera the situation is going down now. It's going down now, but cholera is you see cholera throughout the year. This Lassa fever season we are seriously monitoring, especially the 5 hotspots areas. And the similar things again we are doing, we're just different, because it's a different virus. Very soon we start seeing meningitis. So we need to prepare for all those things again. We are seeing yellow fever in certain states. So we're working hard here with those states now, how to contain them. So we do diphtheria, which are vaccine-preventable disease. We're seeing measles. We're seeing mpox is still on. So HMPV is on the side. We have other things. So the essence is that for a country, if you develop your public health capabilities, you're in a better position to handle any of this.
How is public health, the public health capabilities that you just mentioned right now, how are they functional in places that are violence prone? Like we've been talking about the Northeast and banditry in the Northwest.
Those are challenges we have to face. Like you say, violence, the security issues. So anybody going to work there too has to be security conscious. Unfortunately, again, in those areas, of course, we have challenges there. The essence is that we try and follow, but when you're going to such places, go with security people. Again, public enlightenment has to do, but the health worker or the public health workers who have to defend our people must be protected too. And so it's a national issue for as long as we need to address those security issues again for the public health officials to work.
In addition to the security issues that you have to deal with in those areas, there's also cultural issues. I remember some years ago in Kano, where some health workers were killed when they were trying to do the polio vaccination in those places. What's the update from there? How has our public health structure and, of course, the NCDC and Ministry of Health over the years been able to, adjust the way we do public health so that we do not find ourselves in those situations?
What we call social determinants of health. They have this culture, tradition, the way we see things. So when you are doing public awareness, it's not one size fits all. You have to assess different cultures and see whatever you're going to apply must be culturally sensitive to just sensitive to those areas. So you need experts in this kind of thing. And again, you need the local communities, religious leaders, community leaders. And that's why if you notice again, in some parts of the north, the minister has been very effective in talking to the traditional rulers again, to use them again to actually fight against these cultural issues. You have to explain to them the positive side of this. Because again, if we don't, it becomes a public health issue. Because the spread will be there. Especially like had COVID.
We were looking at the assessment of 2024. 53,000 health workers retrained.
Yeah.
And the malaria vaccine, of course, in parts of the country, it's not everywhere yet. And then, of course, there was the sector-wide annual health review meeting that happened in November of last year.
Yeah.
Just so you can give us an idea, because you're the ones that handle the disease part of things. How do you assess our performance when it comes to disease prevention in the country?
Like, I remember last year I was on China Express in Lagos when your colleague took me out on prevention. I said that now we're focusing on prevention more. In the past, we never used to do this. And in a country or an environment where we are resource constrained, prevention is key. And when I got to NCDC, I also looked at the pillars of actions. The weakest link has been prevention, so the focus is on prevention. And prevention, again, is not as easy as most people think. You use all the different capabilities and professionals you need, like communications professionals, people like you, media professionals. They are in a better position to help us spread this messaging. You need to be able to couch your messages in a way that are culturally sensitive, traditionally sensitive for different parts of the country. So that is key. Hand washing is a major factor. If we all develop the culture of hand washing, it tends to reduce the incidence of most of these communicable diseases. Over 40% of them are reduced.
Just by changing your lifestyle, just by washing your hands.
Precisely.
Under running water.
Under running water. Yeah, hand washing under running water.
Challenge in many parts of this country.
Yes, and that's why again you have to work hand in hand with other agencies of government. They need to understand. That's why again we're talking about one health issue. In this kind of thing again, you deal with Ministry of Agriculture, you need to Ministry of Environment and Health. Most of these diseases are diseases of animals originally.
Yes.
That found themselves into human beings. So if you can all work together under one system, collaborate, because it's same thing, surveillance, detection. They have their own laboratories for animals. They have their own surveillance for animals. We need to work together and again avoid this contact, this spread. We work together, we can effectively do that. The last thing again is antimicrobial resistance, which is huge. Because they have that culture of abuse of antibiotics.
Oh, yeah.
Fake. All those things again. These are things again that actually make us more susceptible to diseases. It's an epidemic on its own. We shall deal with that as well.
I think Ayo has a few questions for you. Ayo, over to you.
Is it there?
Well, yes. I'm here, doctor. So you just had to implicate me on national TV, and that's okay.
You remember what you did last year?
Yes. But there's something you said that I'd like to begin with. When you say it's Lassa fever season. And it happens every time. The first question in my head was, is it not possible for us to totally eliminate it so we don't lose lives and anything to it?
It's possible to eliminate it, but it's going to be tough. One, because it is carried by rats, some species of rats that are found in certain areas in Nigeria here. They call them multi-mammate rats. And then they're part of the ecosystem. That's where these viruses live. Now, when these rats that are infected with these viruses get in contact with humans, it becomes a problem. So to eliminate it's going to take a while. It's going to take a combination of healthcare workers, Ministry of Agriculture and an environment. And of course, the people, we need to change our culture. With the environmental problems again, environmental cleanliness, we need to prevent these rats from coming to our homes. We know there are certain practices again in some areas of this country where foods are spread just on the ground, on the floor, especially grains. These are things that attract these rats. Once they are attracted, it leaves their droppings again. We sell these things and people consume these things. These are things, again, we need to look at again. So that's so many things we need to look at before we start thinking of elimination. So public enlightenment is key. Changing behavior is key. And changing behavior, again, you have to modify how, occupational issues are. You cannot stop people from eating rats. Because to some people, again, it's a delicacy. But you can advise them how to cook this so that it can reduce the incidence of infection.
Well, you know,
That's our question.
Well, yeah, well, you answered it to an extent, and I'll follow up on it. And I know you'll probably, because what you said, your response is speaking to the need for collaboration, even with the ministries of agriculture at the various local levels. Let's hope that projects like this, special agro-industrial processing zones, will eliminate people spreading food on the ground to dry up. But, you know, another issue, another perspective to that is the role that local government administrations can play. I mean, you would know that back in time, you wouldn't dare have an insect-infested water pot in your house. It'll be broken down. So is there a role, and that was the function of environmental officers or sanitation officers at the local government level. Is there a way that that can have a significant effect if the environmental sanitation officers at the local government levels came back on stream? It's possible to do this within a short time, isn't it?
No, well, yeah, it's possible to do that. In fact, these are the kind of decisions we're trying to put in place again now. Because like Riley said, most of these problems are subnational. Now we're working hand in hand with the various DSNOs, that's disease notification officers in different states. We are training them. They are at different local government areas. They are working with the environmental officers in all different local government areas. Again, the idea is that each state must set up their own structure, must have their governance structure to address this issue here. And they're all working with Ministry of Environment and Ministry of Agriculture. It's going to take a while, but once you build these institutions, it becomes easier to address.
All right.
It is not impossible. Yeah. It's just that we have to keep at it.
Because Dr. Idris, we've been talking about eliminating malaria in Nigeria for so many years. So many years. I saw a document, I think sometime back. I said we've been trying to eliminate malaria since pre-independence. And I'm wondering, how difficult could it be, really?
To me, it's a bit difficult because you cannot fully eliminate malaria without environmental control. You can have the vaccines. Vaccines will do their bit. But the point that we need to address how this malaria is spread. And, you know, you go through the life cycle of mosquito. They're all environmentally related. So they have to be environmentally addressed. I hope you understand what I'm saying.
Well, I do. All of it seems to go back to the local government administrations. Is that correct?
Well, no, you can go local government administrations. It also has to do with public awareness, changing culture. You know, take for instance now, you have your what do you call them, gutters and streams, drainage systems that are not flowing nowhere. They are major breeding sites for mosquitoes. Are you with me?
Yes, sir.
So if we can clear the drains, we make them run, the mosquitoes not to breed, so we reduce the population of mosquitoes. That way, again, we can continue like that to do it again, we can towards elimination. And again, there are different styles. I mean, there was time in Lagos that we used to have that indoor residual spraying, larviciding. That's addressing the different stages of lifestyles of mosquitoes, so that they don't grow into adult mosquitoes where disease can actually it can spread. We need to go through that. A lot of countries went through this. Some went beyond that. Now they're also doing genomics, genetic, whatever it is, modification, which is also part of the science.
Dr. Idris, it is crucial for us to eliminate malaria as other diseases.
Very crucial.
Because there are countries who were able to do this within the shortest time. You know better than I do that these things, it just takes the will for us to do it. So what recommendations would you make? I know you may not even be the one to make the call, but part of your job is, as you said, prevention of diseases. And we know the cost of these things, particularly because a lot more people pay for their health out of pocket than use the systems that government has created. So how difficult really could it be? What's the difficulties state governments in particular that you spoke about, subnationals, are having in taking the gauntlet?
We say, like Relax says, it's going to be all of country approach. I mean, take for instance now, you have a city, you have a state. If you don't plan that state very well, you're not going to have proper drainage systems. You're not going to have proper water systems. You're going to have this. These are all things that contribute to development of these diseases. You understand me? So if you plan our cities very well, in planning we address the issue of what are the health needs, what are the water needs, what are the... I mean, take for instance, you can build cities, you don't build public toilets, you don't have you have poorly run water systems, and we don't expect disease to occur. So it's going to take a whole of country approach, but once the government has the will, the people too must play their part. Like I said, everybody has a role to play in this kind of thing.
Okay,
it is not impossible.
Yes.
It is everybody must work together to achieve this.
If we all work together, Dr. Idris, can you give us an idea of how long if we all work together and do what needs to be done, how long do you think it can take us to eliminate malaria, for instance, in Nigeria?
Unfortunately, I can't make that prediction. I can't make that prediction, but you know, you have different factors. You have the infrastructure, you need the financing. Right now, as a country, we are still going through some economic problems again, but which we are trying to we're trying to overcome. But with all this, you need finance, you need infrastructure, you need human resources, you need environment, so many things. So I cannot tell you precisely when. We have a huge population. We have a huge population. We are a large country. So those countries, again, that were able to eliminate, they probably have low population, they use technology and that kind of thing. So a combination of this can be used to reduce the time interval for us to get to that elimination stage.
Okay, well, one other issue that's I'm sure you're also as concerned about is non-communicable diseases. Available information says non-communicable diseases are responsible for 74% of all deaths. And that definitely is something that is concerning for health practitioners such as yourself. Talk to us about what we need to do and what government can do to help.
Well, I'll talk of lifestyle. And this has huge ramifications. What we eat, our physical activities, you know, how we relate to each other, transportation issues. These are key things here. But remember that it takes moderation, nutrition again, exercise. You know, they talk about these are preventive issues. Regular exercises, good nutrition, regular medical checkups. You understand me? And again, you have all your health facilities. You seek medical attention as quickly as you can, so that once it starts developing again, you need them on the board. And again, you start all this education right at the younger ages in our schools, in our primary, secondary schools, universities, and of course, again, you train a medical medical workers again on how to address issues. And of course, the issue of technology is there. So many things again, lifestyle issues for non-communicable diseases, but there are some of them again, cancers, diabetes, hypertension, arthritis, sickle cell, all those things. These are things again that also have genetic basis again. Also now with technology, you're going to genomic medicine. These are areas again now that actually facilitate early detection of diseases, and you can treat them in different with different modalities. So it's a combination of things like how do you put it? Awareness creation, prevention, detection. If you can't prevent, you must be able to detect. If you detect and detect early, you can treat early.
Now, how about this? Now, this treatment is another issue. You mentioned cancer as one of the non-communicable diseases that's killing, of course, everyone. The mere fact that anyone even mentions cancer is threatening enough on its own. Now, what would be your thoughts on medical tourism? And what do you think government can do to prevent that? Nigerians spend humongous resources, right, to treat diseases outside of the country. And it speaks to just one thing, perhaps the absence of some of this infrastructure they need, or even a lack of trust in the health, in the disease control elements that we have in the country. What are your thoughts on that?
Well, I think this is a changing. I know from this current administration, efforts are being made again to address this. You recollect again that if you remember what the Honorable Minister said some time ago again, they're building a number of cancer centers. You're working hand in hand with people in diaspora. And I must tell you, the private sector is key to this. I know a lot of private sector facilities that have the capability to treat all of this, whether it's cardiology, whether it's cancer, whether it's oncology, renal issues. We have the people, but once we provide that enabling environment here, we have the support of government, which this government is trying to do now. They're working hand in hand with the private sector, they're encouraging the sector. All the things the private sector people require that they had difficulty bringing in for people to treat their patients now, government is trying to reduce that again, make them easier to acquire. And you have a lot of private facilities springing up now in different specialties. That is positive. You know, once you have those ones again, can attract the health workers who are in diaspora, who will not ordinarily come here. They're coming here. I know one of the young guys there, one young guy in Lagos there, he did serious work in interventional radiology. He's treating cases that ordinarily would not be thought of treating, people would have gone, and he's succeeding. All we need to do as a government is support such people. And that's what this present government is doing.
I mean, I listened to the health minister when the unlocking, the presidential unlocking of the healthcare.
That's another day. Look at
healthcare value chain initiative of the president. Yeah, so to look at it as a business and see how we can mix it. In fact, he said he had a plan, 70% to cover 70% of total consumption of drugs in Nigeria by 2030.
We must be able to manufacture a lot of this here.
With that in mind. This 5.16% that was budgeted for the health sector, will it be achievable with that amount? It's way lower than the expected amount that has been given to us by the international organizations that we ascribe to, saying, look, there's a percentage. For us to be able to have realistic goals, we need that funding.
I agree with you that the funding is totally inadequate. There's no doubt about that. However, again, over the years, no matter how small it is, how well have we utilized them? That's one. Two, I know that this present government has put little emphasis on the health sector. Apart from funding, they're supporting all the various things again that can improve on this things. And with that, again, with the gesture of government, again, this is attracting some external funding too. As the economy improves, I can assure you that, again, funding will increase.
In fact, he talked about the investments. It's in billions, the investments that we got at least in 2024 alone into the health sector, and what those investments are supposed to help us achieve as a country. In 2025, what's the plan?
For the health sector?
Yes. And the NCDC?
The plan for the NCDC. One, we want to upgrade our capabilities using technology. We want to use our digital issues to make faster. We want to increase our capability to detect diseases. Using we started genomic sequencing. You know, we are working hand in hand again. I mean, you can use that again to test different diseases, mpox, in a shorter period of time. That's one, right? We're going to train our staff again because these are specific public health workforce. Very different again. Empower them to do what we want to do. Increase our surveillance systems again. Now, apart from the normal environmental, we're going to environmental surveillance now. You go into environment, it samples some of these surveillance. It's there again, you see all sorts of viruses, germs.
I want us to talk about that for a little bit. Back in the day, and I'm sure me and Ayo, we've talked about this before.
Yeah.
Back in the day, if you wanted to find out why there was dysentery, I tell you, there was a dysentery outbreak in parts of this country. If you wanted to find out why there was dysentery, there were these people that these health workers, we don't know if they were doctors or not, they used to show up during the weekends, and then they would pour kerosene into public toilets around the city. At least the city I grew up in was Kaduna. They'll put kerosene into all those places, and then any house in the vicinity that opens up their tap and the water smells like kerosene, they would know that something is leaking from the sewage system into the drinking water. So they could trace those diseases.
Yeah.
When it comes to those, I don't know what we're called, we're sanitation workers. We used to do sanitation during the weekends. Are those things coming back? Is that part of the plan for this year?
It's a plan for the health sector, but all those people, they work at the local government facilities, sub-national. Are you with me? Again, what we do in this country, when we say environmental surveillance, is that we sample different parts of the environment, the stagnant water, sewage systems, water systems, look at the various diseases there. It's from there again they want to detect these polio viruses.
Yes. It's
in those places you can detect some of these, maybe cholera viruses, salmonella, all those. They have many, many germs in those things. But you can sample them again, it gives you an idea of what and what we are going to deal with in the environment. You start planning for them. It's a way of supporting us. So if you look at those germs again, you sequence them in terms of DNA structure, genome structures. You can know which is capable of causing disease or whether there is a mutation going on so that again, in future again, some other things can come up. In the same way again, use the same thing again in the hospital again to look at personal health, human health.
Yeah.
They use the genomic sequencing again to check your body, the DNA structures. It's the same system you're using now to treat sickle cell people. By using genome sequencing or whatever it is again to change their program and they make them normal.
2.4 million Nigerians are in the National Health Insurance Scheme just in 2024 alone. And it's applaudable. But it's also brought up the question, and Ayo mentioned that I didn't quite get a full response from you. So I'm going to bring it back. We talked about affordable healthcare.
Yeah.
Affordable healthcare. We see all the work that the minister is trying to do with primary healthcare centers across the country, work that he has been doing for many years. But when it comes to affordable healthcare, a lot of people are paying from their pockets, especially for diseases that government should naturally just be able to handle. And we still have one of the highest levels of maternal mortality in this country, in the world even, which is not a very good look for us. Open deification is still very, very big in Nigeria, So while we're talking about lifestyles and telling people to change the way they live and incorporate these healthy ways of living, in what ways really can we ensure that people do not have to be paying for some of the things that they shouldn't be paying for?
I agree with you. The out-of-pocket payment in this country is almost about 70%. People out of pocket, which is poor. The target is to reduce that to as low as about 30%. But this environment is a bit difficult. One, people do not want to pay for health sector for many reasons. One is poverty. Do they have the wherewithal to pay? That's one. Two, can government afford to pay for everybody? You know the answer in the context of our economic situation. So how do you do that? So again, education also comes in. Many people, to me now, many people do not even know much about the health. Insurance. They don't understand what health insurance is. So there's a need for serious public awareness of health insurance. In some parts of the country, again, I hear that the culture too, or traditions, is against paying for health. I don't know. These are things we need to deal with. You understand? But again, now, each state is supposed to set up its own health insurance agency. It's going to take a while. But my take is that we still require more enlightenment on health insurance. And if we do not gain the trust of the people, we won't succeed. That's the issue. Because over the years now, like social insurance, some of those things again, people say, okay, I haven't seen the benefit. So we need to do something to gain the trust of the people. It requires a lot of work. That's my take. But again, people again must learn to take care of themselves too. Because health is for everybody. I don't see why a man who is earning peanuts will go and marry many wives and many children and expect government to take care of that. You understand me? So there's a need for, some restraints on us too. Like I say, government has its own role to play. People themselves, we people that have our own roles to play, we need to also work together. And we can only do this again with serious public enlightenment, serious engagement. which the minister is doing that with some of the traditional rulers. Everybody must do that. We need a healthcare financing system, there's no doubt. Because if there's no health insurance, we're wasting our time. Because the government cannot afford to pay for everything. You yourself know it, 5.7%. Apart from health, you're dealing with education, you're dealing with defense, you're dealing with environment, so many things. So you understand? Because some of this funding going to environments that are properly used together can be used to do things again that also have positive effect on health.
In what ways, as we wrap up, in what ways is the NCDC going to improve vaccination coverage this year? And not just vaccination for HMPV, if that happens. For other...
NCDC doesn't handle vaccines. NCDC doesn't handle vaccines.
Okay.
But we work hand in hand in National Primary Healthcare Development Agency, who has that remit for vaccines. However, I'm heading a task force trying to work on the vaccine for Lassa fever.
Okay.
Lassa fever vaccine. And we're going to start doing similar again. It also requires research work, working with the academia, working with the private sector to be able to develop this. So in a way, the best way is to have vaccines. But again, developing vaccines again is a tedious thing. It requires technology, it requires expertise, it requires funding. But we'll rather get there.
Are you working with institutions like the University of Lagos?
Oh, it's everywhere.
All those public health
and the task force involves people from the academia. Many of the universities up north, down south. Private sector. So many things. So people bringing all their various expertise in place. Once they're not doing the clinical trials now for the candidate we have. And they're in stages. When they get to the high stage now, they can start producing. You start now thinking of how do you manufacture in large quantities. So the plan is there. And that's why, again, for that, unlocking the value chain is key. Because all throughout the year, we've been totally dependent on the external people. And then after a while, we forgot to budget for things like this because we don't have the money. And once this happens, they withdraw the funding when soup. So we have to take charge of our own.
Speaking of collaborations, I mean, the governor, I think the governor of Plateau State, was talking about how one of the drives for this year is local manufacturing of medicine and trying to handle diseases that are at local levels. These are things that we shouldn't be having to go to teaching hospitals for. These are things that you can handle in primary healthcare centers and whatnot. You know, with our minister, who is a public health person. How do you find that unfolding? Do you find our public health infrastructure going to be a little bit more proactive in this year?
We are moving in the right direction now. You know, in the past, we need to be totally clinically oriented. Anything on health was hospital-based. And to me, that takes only 20-25% of the health sector. If you don't deal with public health issues, we're wasting our time. Now we're addressing those issues, so we're moving in the right direction.
We'll be watching to see how it all unfolds.
You're part of the team.
Yes, yes, I am. I am part of that team. You know, I want to thank you very much, Dr. Jide Idris, the Director General of the Nigeria Center for Disease Control. Thank you so much for being with us on Sunrise Daily, and good luck.
Thank you.
With all the work that you have ahead of you.
Thank you.
Business on Sunrise Daily comes up next. Please stay with us.